Welcome back to UC Davis Live COVID-19. Even as vaccines for COVID-19 become more widely available, surveys show that some people may decide to not get vaccinated. Often they base that choice on misinformation spread over social media. So how can public health authorities combat this kind of misinformation? Well, joining us today are two UC Davis experts in communication who have studied some of the myths around vaccination and ways to fight them. Jingwen Zhang is an assistant professor of communication at UC Davis. Her research interests are in health promotion, social influence, and interventions through online communications networks. Magdalena Wojciechak is a professor of communication at UC Davis. She's interested in how the changing media environment creates both opportunities and challenges for informed publics, tolerant citizenry, and responsive governance. Zhang and Wojciechak are co-authors on a study published earlier this month on how best to combat vaccine misinformation on social media. Thanks to you both for coming on today.
Thank you for having us.
Thank you for having us.
Yes, so before we get started, I just wanted to remind viewers that this is a free webcast. You can watch it live and watch it after the live broadcast on the UC Davis Facebook, Twitter, and YouTube channels. We're aware of others posting links saying that you have to pay to watch this video. Please do not click on those links. This is a free webcast. And we are taking audience questions. So if you're watching us live, just leave them in the comments section and we'll work in as many as we can. So Jingwen, let me start with you. How big a role does social media play in spreading misinformation about vaccines?
Because the first thing is to understand social media just gives access to everybody to post information, to express their own opinions, and also talk about their own experiences, right? So given this unlimited access, everyone can actually say anything about vaccines on social media and spread it to their friends and colleagues and family networks, right? So it is actually very natural for humans to try to say something that is really interesting and also very novel, that sometimes those type of claims are not based on scientific evidence, right? So for example, if I kind of feel I found something that is really interesting, sometimes it would be about misinformation or unfounded claims or even conspiracy ideations. For individuals, they may find it's really exciting in the sense that it's novel, that they want to share it out to other people, to feel like they know more about this topic than other people, right? So it's very natural in the sense that people like to share this type of a very emotional, arousing information on social media. So that's why we kind of like understand why misinformation gets a higher probability to be spread largely on social media.
People, go ahead. Yes, please.
You can go ahead. Sorry.
Oh no, I thought Magdalena was going to jump in there. Okay,
Sure,
so
absolutely.
yeah, please.
So I just want to say that what Jingwen is saying is absolutely correct. And in addition to that, there is some evidence that it's actually the older demographics in the population that spread misinformation at much higher rates than the younger demographics as well. And that can be partly due to lower digital literacy, for instance. And in the context of political misinformation more broadly, there's also evidence that there's not that much misinformation out there on social media, even though, especially the vaccine misinformation, even though it may not be extremely widespread or form a small proportion of online content, has extremely important consequences for society and individual lives.
I think a lot of the misinformation can be spread there in some instances by people who may have an agenda, who may want to influence people on, but I think also a lot of people just, they see something that either seems outrageous or just different, or, you know, maybe has something to do very deeply with their lives, and they want to share it with people because they feel it's important that this new information get around. Right. So it's kind of like, you know, there's some people who are purposely doing it, and then there are other people who are just kind of duped out of human nature to like spread this misinformation. So in your study, how did you address misinformation? What worked best, either of you?
Mm-hmm. So I can start first to referring to the recent paper that we published on preventive medicine. So in that paper, we tested one straightforward social media approach to tag those misinformation claims as false. So it's basically when we see a misinformation post appearing on social media, we tested to give it a label under that post saying this post has been falsified by different sources. And then we showed that by giving people this label, the tag of falsification actually influenced their attitude towards vaccines in general. So in a more technical way, what I want to say is that when people are seeing misinformation post, that information decreased their pro-vaccination attitude. So makes people less likely to accept a vaccine. When people see misinformation falsified, that intervention itself actually increased pro-vaccine attitude a little bit. So that means this simple, straightforward label would actually be effective in helping us to move people's acceptance towards vaccines in the right direction. Yeah, so that's the study.
And
Right.
I only want to add, which I feel is extremely important, is that to my knowledge, ours was one of not that many studies that actually looked at populations that are more skeptical toward vaccines to begin with. So typically many studies on correcting misinformation in general look at the general population. But we also know that the majority of the population doesn't necessarily endorse misinformation. So kind of there isn't really that much to correct. But unlike most of the other studies, we looked at a sample of American population that's more likely to have greater vaccine hesitancy to begin with.
So you're talking about basically labeling when a false, say, Twitter post goes out, you're then labeling it saying this is false, right? So who is the authority who is labeling it, and how important is that to the people reading the claim that this is false?
Right. So that's exactly the research question we asked in the study from the very beginning. We wanted to know which sources that are providing this type of checking are the most effective in delivering that type of effects, right? So we tested different categories of sources ranging from health authorities of like CDC, FDA, and medical institutions like Mayo Clinic. And then, for example, the recent development of artificial intelligence algorithms, that's also one category. And then we tested research universities like Johns Hopkins, Duke University. And then we also tested traditional media like ABC, Fox, MSNBC. And lastly, we also had fact-checking organizations that are dedicated to checking misinformation online. So across these different categories of sources providing that fact-checking labels, we found research universities and health institutions were rated as with the highest level of perceived expertise in correcting this type of misinformation. And that elevated trust from those sources would actually induce the most effect in changing people's pro-vaccine attitude. So based on that evidence, we would wanted to call for more engagement from research universities, institutions, and health institutions or organizations to more proactively check and provide those type of information to the public when we see such misinformation is circulated on social media.
And we've seen some platforms like Twitter and Facebook, following up with some, these outrageous posts that people make with, a banner saying this has been proven to be false. But have we seen any kind of formal partnerships between these social media companies and maybe some of these health institutions to partner to do that on a more regular basis?
Mm-hmm. And I'll just first talk about on the health realm, and then Magdalena can chime in with the political information. So for the health misinformation issue, starting with the COVID-19, WHO and the CDC have started collaborating with Facebook and Instagram to actually direct people to the credible sources for getting information about COVID-19. So that was the very fast and right move that WHO and CDC have been making in collaboration on Facebook. I think one reason for this very quick jump on collaboration was because the misinformation problem, especially on the vaccine, has been existing for many years, even before the COVID-19. So back in 2019, Facebook already recognized this problem and they tested several different approaches, right? So based on the years of experimentation and also scientific evidence, I think with the COVID also getting into us, that was the time when they finally started this type of collaboration by providing people with additional links and then trying to algorithmically put the credible links on the top of people's newsfeed. So that was the current collaboration practices that they're doing. But there's not the large scale implementation of what we tested in our experiment, which was to label individual specific posts on misinformation claims. I think to able to do that, there will be more technical challenges from the platform side that I think there's still some time to work it out, but the collaboration has already started. So that's a positive signal that at least we have some positive reactions from social media platforms that are willing to engage with this problem.
Yes, and in fact, social media platforms, and I know more about Facebook's initiatives than about Twitter's initiatives, are also collaborating with existing fact-checking organizations to fact-check other misinformation that can be seen as political. And in that realm, I include also vaccine misinformation, because unfortunately in the United States and elsewhere, COVID-19 and vaccines have become very politicized. So platforms are working with fact-checking organizations and have been fact-checking political misinformation, sometimes also taking it down, as we know. But here the problem is, which we are also seeing as a problem with regard to COVID and COVID vaccines, is that many people have very strong prior attitudes on various issues and can see such fact-checking or removal interventions as a threat to free speech or freedom of expression and so forth. And that can actually anger the very individuals who are most at need of those interventions. So the people who we want to correct misperceptions amongst are most likely those who are not willing to be open to those interventions, and who are then willing to, or more likely to, accuse the platforms of some bias or censorship.
Right. Just a reminder to our viewers, we are taking audience questions. So if you're watching us live, just leave them in the comments section and we will work in as many as we can. Magdalena, are we seeing similar trends in COVID-19 misinformation compared to the misinformation we've seen in the past with other vaccines? Or are there new aspects to the misinformation that surrounds COVID-19 vaccines?
So because vaccines per se are not the key focus of my research, I will let Jingwen answer that question. But I only want to mention that COVID, unlike, to my knowledge, some other vaccines or diseases, is much more politicized. And that's partly because of the past year and the rhetoric and communications from the administration. But also, unlike, again, to my knowledge, and I will let Jingwen speak about that more, it's much more strongly linked with partisanship. So attitudes toward the vaccines, attitudes toward social distancing, attitudes toward reopening businesses or wearing masks are very strongly correlated with whether people are liberal, conservative, Democrats, or Republicans. So the response to COVID-19 in general and to vaccine in particular as well is very clearly divided along partisan lines, and counties even that are more, red counties, so to speak, are behaving very differently than blue counties in the United States. So, to my knowledge, and based on some research done in political science, this divide is huge, and I do not think, but again, Jingwen will speak to that we saw such a divide in terms of other vaccines.
Jingwen?
Yeah, I fully agree with Magdalena. I think the research evidence are still coming in to talk more about that division lines between the different ideological spectrums. Just from a more scientific or public health perspective, the COVID-19 vaccine is different from the previous vaccines because this is totally new, right? So COVID virus was discovered just last year, and the vaccine was just developed with this huge speed that was never seen in the history, right? So we have to take all of this context into consideration in order to understand why people are hesitant and not that confident in that vaccine. It's very easy to understand, right? So you just discover this new virus and you develop a vaccine within several months, and you already tested with this 30,000 people in the United States and showed the evidence. Everything is just like on a rocket ship. And I think for even like individuals like me who have been researching about this issue can feel that type of uncertainty and anxiety. That's very natural and that's very understandable. We wouldn't expect anyone to just have a blind faith in this vaccine coming out, for everyone to just accept it. So I think the real issue here is trying to get individuals, including ourselves, to be more informed and open about new scientific information coming into our decision-making equation, right? So when we think about whether to vaccinate ourselves or help our families to get vaccinated, it's really this very important decision that every individual has to think about, and then to weigh the benefits and the risks, and also get as much as information that we can from credible sources in order to understand the issue. Because also of this uncertainty and the new scientific discoveries, it's very easy for rumors and misinformation to spread, because we are still like in the stage of trying to assimilate all types of information to try to make the best decision. So like on a personal level, I think not many weeks ago, I oftentimes hear about friends like just talking about COVID vaccine and the issue, because it's really very top on people's agenda. And someone would just check a phone and saying, oh, I got this information on social media saying the COVID-19 vaccine would be causing women to be infertile, right? So it's just a very common like type of like intuitions that people have about this new thing, and they are kind of like very worried. And then, so what do we do with that situation when someone just throw you with a misinformation claim or rumor or unverified so far? So I think in that situation, we have to have this mindset that we are not just blindly being influenced by different voices. We have to be more vigilant about what information we're trying to consume, and also trying to find any other sources that can verify or falsify those type of claims. And sometimes because we are living in social networks, that we have so much like knowledge pool coming from different people working in different sectors, right? Exchanging those type of opinions and information is very crucial. Let's see, if my friend is talking to me, and then I can provide information I know, and maybe my friend who's a biology professor in UC Davis can also chime in with more educational information on mRNA, right? So when the conversations would start, and then we see information gets exchanged, so some of those like doubts and worries maybe suppressed a little bit because of this more enlightened understanding or more informed understanding of the issue.
Right.
Yeah. And
go ahead,
if I may follow up on that, I fully agree with everything Jingwen said. But also, I realize that many people who may be hesitant do not have the time or are unwilling to, check the sources, go to CDC website, look for medical information, may not have, biology professors from UC Davis in their social networks, right? So in this case, again, when we cannot expect that individuals will be actively seeking very thorough, very authoritative information on the matter, we can also be kind of exemplars, easy, exemplars for other people in our social networks. So, for instance, whenever one of our family members or friends gets vaccinated, we can post like, hey, my mom got the vaccine, she's perfectly fine, there were no side effects, for instance, right? And other people who are not necessarily going to any websites or searching for information would just see that post, and that post actually is incredibly credible because it comes from somebody who they know, and it comes from somebody who got that experience and who is fine. So this kind of persuasion based on narrative exemplars, so to speak, or concrete cases of individuals is very persuasive and can actually work much better in some cases for some individuals than kind of hard data and statistics and numbers on, safety versus side effects. So I wanted to say that. And also what Jingwen was saying about engaging in those conversations, right? So right now, our intervention that we tested in the project is not actively implemented on social media, but we can be our fact checkers, right? Mm-hmm. We can be those who are saying like, hey, this post is not really true, and here is the falsification link.
Mm-hmm. Right. Well, that's the power of social media, is that you can have an informed kind of conversation over it, or an uninformed conversation, and they spread just as quickly and as powerfully. So that's kind of the challenge with social media today, is the platforms can be used for good or for not so good. Yeah. I just want to remind our listeners that and our viewers that we are taking questions. If you're watching us live, you can leave them in the comments section, and we'll work in as many as we can. Magdalena, your study was carried out before the pandemic. So how applicable do you think the results are to COVID-19? Or maybe that's a question for Xin Wang, I'm not sure.
Oh, you can go ahead.
I mean, I do think they're very applicable. It's as you know, as Jingwen emphasized, we tested numerous different sources. We tested numerous different vaccines, and I do see these findings as robust, right? Again, as Jingwen mentioned, COVID-19 is very, very new. And there is greater skepticism of the vaccine itself and greater divides along ideological lines. But I do think that based on our rather robust and generalizable findings, the results are applicable. And whether or not they are, it's a testable proposition. So actually, that's an idea for a future study, perhaps.
Right. Yeah.
I wanted to go back to that point where where you said people are worried about the vaccine because it seemed to have happened so quickly. And I think, the messaging around that is that, well, it seems to have happened so quickly because this was the first kind of high profile vaccine to use this relatively new technology, but it's been around for 10 or 15 years. This is just the first time people are hearing it. So that's like kind of a message that people maybe are not hearing when they're looking at how quickly the vaccine apparently seemed to be developed.
Yeah. I think you touched upon a very important issue for public health communications, right? Because given this, every day there's new kind of news release on vaccine trials, vaccine effectiveness, or like it's just a lot of information coming into people's media diet, right? So how do we actually navigate this different information? Sometimes emphasizing on trial effectiveness, other times emphasizing on like some uncertainty aspects, right? I know like scientific community doesn't agree with that, but there's different voices coming even from kind of medical journals talking about those, right? And there's different tiers of publication. Some could be just an op-ed opinion piece published on British Medical Journal versus other more validated scientific research coming from New England Journal of Medicine. So, but for an average individual, it's very difficult to actually evaluate which one is actually more credible and which one should actually believe into. So that's something that I think public health communication professionals have to come into the conversation and come to give people like a more information about how to actually deal with this different type of information that may create appearance of a disagreement, even though there's no underlying disagreement, right? So that's something that I have been observing and following on this back and forth with Twitter discussions or Facebook discussions for several months so far. So I think that's some work that it's really have to be done with more in depth from us and also from the larger scientific community to think about this contribution of different sides of the voices that are so easily communicated on social media.
Yeah, and I want to kind of follow up with 2 points. So regarding the speed with which the vaccine was developed, that's actually, as you both said, a very big and important factor in public skepticism. But also, as we see more and more people being vaccinated, as we see more and more posts about, hey, I got my vaccine and I'm perfect on social media, the more the skepticism with time will decrease, I believe. So the numbers that we're seeing among the American public that doesn't want to get vaccinated because they are afraid will decrease as more and more people get the vaccine and the side effects are not immediately detected or visible. And the second thing regarding what Jingwen mentioned about public health communication, another aspect that's absolutely crucial, and that's in any kind of persuasive campaign, so to speak, is that public health communications officials need to be working with community representatives, right? This is because, again, most people don't even go to British Journal of Medicine or any other journals like that, and they will not see a website that reports those findings. And many people may not trust public health officials at all. And again, the people who need to trust those officials the most are the ones who are least likely to trust them. So for that reason, also reaching out to local community center networks, their so-called opinion leaders, is extremely important in the success of this undertaking and any persuasive campaign, whether health or political or other.
Right.
We have a question from a viewer, Craig, who's watching on Facebook, is asking, why isn't the publishing of misinformation a crime?
So, being from Europe, where, for instance, Facebook is obliged by law to take, for instance, neo-Nazi or Holocaust denial content within 24 hours, to me, that should be the case, that misinformation regarding, for instance, COVID or other aspects that can have influence on people's lives may need to be criminalized, but that kind of claim is extremely controversial in the United States, that just prides itself at its freedom of speech. And again, sometimes this freedom of speech is at the expense of public good, and this is where European policymaking prioritizes public good, whereas in the United States, still the idea of free speech and censorship is extremely or very strongly ingrained.
Right.
So my responses to that question will have 2 points. One is when we talk about misinformation, especially in the realm of medicine or vaccine, right? We have to first set a boundary of saying what is considered as misinformation. So that's actually not a trivial question to ask, right? This issue has been dealt with within the scholar community for a long time, because there's so many different forms of information, free expressions on internet. How do we determine, this claim is misinformation versus the other person telling a story is not misinformation? So that's the first thing. We have to understand the content spectrum of what we deem as misinformation, especially with medical interventions and innovations. There is not always like black white kind of like it's true or it's false, because with time going on, there could be new discoveries in the scientific realm that may actually overturn a previous scientific recommendation. That's very common, I think, especially given the new virus and the new behavior recommendations and policies. I think we have been seeing this kind of rolled out with the pandemic, right? So first, there was recommendations about just people who are kind of feeling sick, they have to wear masks, and now everyone is recommended to do it. So we have to be open to some extent to these updates in scientific discoveries and new scientific evidences, and couldn't just like within a time always just saying that standard could be changed over time. So that's what I think we need to be aware of. And then that's exactly the challenge of saying, okay, that's misinformation is criminal, right? So that's very difficult to make that decision. The second important point here is that sometimes the misinformation does not come from like a regular person on Instagram or Facebook. It comes from the top-down government, right? So that's a bigger challenge that we're seeing in this pandemic, that for example, conspiracy ideations, conspiracy arguments can come from the top officials, maybe in the US and also maybe from other countries like China, right? So they may accuse certain labs of creating that virus as bioweapon. how do we deal with that? And I think that's a much bigger problem. As we're saying, like whether social media platforms are solely responsible for the misinformation, it's not. It's actually a lot of bigger players here that are empowered, that are specifically trying to create narratives in one direction or the other. So how do we actually address that issue? It's another challenge that I think we're currently thinking of. And a recent paper that we published actually documented some of those misinformation narratives promoted by the U.S. and the Chinese government over the trajectory of the COVID-19. Yeah.
Right. Well, actually, that relates to a question that we got from another viewer. Jennifer, who's watching on YouTube, is asking, what are some of the specific misinformation myths about the vaccine being shared? And I guess I'm comfortable sharing them as long as we're clear that we're debunking them.
Right. Totally. Yeah. And so the ones that I have been seeing that have been really popular on social media is one that claims this vaccine is causing young women to be infertile because of some of the ingredients, and that claim is totally ungrounded with anything, right? It's just someone's suspicion of the ingredients in that. And I just tell the audience that this misinformation rumor has been debunked and falsified already by many different sources. If you check websites from the CDC or from research universities, and you will find the specific explanation of saying why that is not true, because the ingredients are not the ones that are having anything to do with bearing a child. Yeah.
And I only want to say I don't have an answer to that. I haven't studied the COVID-19 vaccine narratives, but what we're doing right now is potentially problematic. And as you said, Soterios, right, we are repeating those misinformed and false claims and giving them visibility. So for instance, I had no idea, Jingwen, that was one of the false claims circulating on social media about COVID-19 vaccine. And now I know, right? And there's also research, and that's also this field of work is so tricky and so consequential, because there's research that even traditional media mentioning misinformation not only amplifies misinformation and gives it the reach that otherwise, without that mass media coverage, misinformation wouldn't have, but also can have lasting impact on people's attitudes, right? So for instance, I may know that, okay, this has been debunked, right? And so this is not true, and I know it, but still my underlying attitudes toward related issues toward the vaccine can still be influenced, even though I know something has been falsified, right? So I would also additionally urge journalists, news media, interviewees in general, right, to not give additional platform, free platform and amplifying platform for those misinformed voices to spread. That can be very detrimental because, again, as I mentioned at the start, there is research that very few people online are actually exposed to misinformation, right? Again, this is not research that relates to COVID-19. This is more kind of political related, but not that many people see misinformation online. And then again, the media coming and covering misinformation gives it reach that's much greater, and that most people wouldn't see without that coverage. So this is something that I also very much want to caution everybody about.
Right. And it seems like, in the past, I think the media served as more of a gateway to putting information out, whereas today, everyone has access to social media. So if there are rumors out there, well, people are talking about it. So now we have to talk about it as the media. It just creates this this cycle that just never ends.
Exactly.
Right.
Yeah, I want to add to that because I think that's a very important issue we really want to point out, because we have done some empirical work trying to classify the prevalence of vaccine misinformation on social media. So I would say that our data showed that it's not like what you could wanted to highlight in the media agenda is like most of those content misinformation, it's actually the opposite. So it's only less than 10% of the posts, social media posts, actually contain misinformation claims. So if you think like less than 10% is actually a minority of information circulated on social media content misinformation. But on the opposite, right? So now if you're talking about the issue, it appears like in the media discussion, oh, this is the huge problem, indicating that it's a majority of information content misinformation. So it's actually very different in that sense. So we want to alert people to not be impacted by the misinformation, but we also don't want to amplify the idea that it actually dominates our media environment to some extent. Yeah.
Well, Olivia, who's watching on Facebook, asks, what about misinformation that's embedded in largely accurate news articles or posts, or expressed through individually accurate statements that taken together communicate something that's not true? Is it more complex to put a false label on content or posts like that?
Yes, partly because that correction will be kind of post factum, right? So people have read an article and that an errata comes and says that, oh, actually the claim that was made in the article is not true. But again, most people have been exposed already, and many people may not be exposed to this post factum correction. So one of the things that's great about the study that Jingwen and I did is that the falsifications, and again, kind of the power of correcting misinformation on social media, is that the falsifications can be added to misinformation at the very moment of exposure. So when you already see something, you already know that this has been falsified, right? When it comes to correcting information from more traditional media articles in newspapers or TV, that's much more difficult because, again, you're exposed to misinformation only. And even if correction comes afterwards, you may either not see it, but also, again, there is research in political domain that seeing that correction later will not fully annihilate the misinforming effects of the initial exposure to the false claim in a newspaper, for instance.
Right, right.
To add to that, it's not only that, for example, let's see a post with a falsification label. I think it also did something good here is to deter people from even engaging with that original misinformation in the first place, right? So imagine that if you see a misinformation post already falsified, what is the likelihood that you're clicking into that misinformation? So on a large scale, my prediction would be that if those posts would be flagged, right? So it actually stopped the engagement with the misinformation in the first place. So from the very initial phase of attention and engagement, it may actually reduce the exposure to some extent. So if that's the case, then we on a large scale would reduce the impact from that end as well.
We have another question from Craig, who's watching on Facebook. He asks, given the persistent nature of misinformation, should all major vaccination programs be pre-funded to include an anti-misinformation campaign? Is that one of the answers?
I think that's a very good suggestion. So I think for a long time, also amplified by this COVID-19 pandemic, is that we really have to do much more than what we currently do with regard to public health communication to really be proactive about addressing possible doubts, worries, anxieties surrounded with this a new disease pandemic or the vaccine. So I think a funding or certain efforts that embedded in vaccination programs that is really targeted towards publicly communicating about the benefits and then addressing those potential misinformation would be very good and beneficial to the whole. Yeah.
Absolutely. I think it's a very good idea. And just only kind of I want to emphasize that again, there will be many people and segments of the population that will see those efforts as propaganda, efforts that are aiming at manipulating the public. So on social media now, with the various conspiracy groups, we are seeing huge distrust in whatever information that comes from fact checkers, from traditional news media, from any organization. So kind of knowing that, let's say there was a fund set aside for combating misinformation, can be perceived by some individuals as a fund aimed at combating free speech or their freedom of expression. And that is very, very tricky, because the radicalization of different conspiracy groups that we have been observing in the last months just makes some of those efforts be seen again as propagandistic, manipulative, and aimed at silencing the groups that are becoming radicalized.
Mm-hmm.
Yeah.
Yeah.
Go ahead.
So yeah, I also want to say that that's when I think when I was thinking about like adding that effort in this vaccination program is not just communicating from the very top down with kind of like officials talking about those information. So some of the efforts could be built into community interventions or online networks that are actually facilitating these conversations by the people, by the communities themselves, right? So it's not just like a one-way direct communication, but really this in like a participatory communication that could also happen, but would be actually requiring some effort from organizers like the different programs.
So we're gonna have to wrap up in a few minutes, but before we go, I wanted to ask you, what effect does conspiratorial thinking have on how people receive information? You touched on that a little bit, but it almost seems like, people who are prone to conspiratorial thinking are just going to just go there if something is said that they don't agree with.
Mm-hmm. So I want to point out one finding from our study that we actually tested people's baseline conspiracy ideation. So we had different people on different levels of conspiracy preference, and we actually saw the effect of the fact-checking label on the people who are having a baseline high level of conspiracy ideation. So that finding is kind of like promising in the sense that I can still see this label itself can change that type of individual's vaccine attitude. Of course, we didn't really do like in-depth focus interviews with them to see like, oh, how did you actually change your attitude towards vaccine because of seeing the label? But at least based on their surveys, we could see the significant change. So I think the next step of the research would be actually getting deeper into understanding how they're actually engaging with this type of correction labeling approach and see what was really happening. But conspiracy could be like a larger kind of word will type of skepticism towards the authorities and establishment. And then in a very specific issue like vaccine, because it's so relevant to the individual's health, maybe there's something that is different going on. Yeah, so that's my take on that finding.
Yeah, and I also want to mention that there is a very important interaction between individual tendency to idealize conspiracy theories or be prone to engage in them and social media, right? Because it's the network in which we are embedded that also influences the information and the viewpoints that we are exposed to. And there can be kind of a reinforcement feedback loop in which a person who was initially perhaps a little prone to those conspiratorial thinkings will actually be much more will get into that hole, so to speak, very strongly and very quickly. And here I believe that's the importance of interventions kind of pretty early on before people get fully radicalized. And there are efforts to pull people back from various conspiracy groups. And again, the earlier that happens, the better.
Right. Because as our media landscape becomes more and more fragmented and decentralized, I mean, the problem just grows from there. I mean, it's harder and harder to control. So just to wrap up, do you think social media companies should be leading the way on this, or are there things that federal, state, or local agencies should be doing?
Jingwen, do you want to take that?
I think they definitely should not be the sole decider of like dictator of the content and moderation process. In order for the platforms to gain legitimacy from the audience, I think they have to be more like open to other collaborations and collaborations with other sectors of the society in order to make sure that the whole procedure of content moderation follow with certain rules and policies that are transparent and open to the people. That's the only way I think the public will see those type of content moderation as legitimate efforts of moderating this space. And otherwise, for example, Twitter just say, we decide to ban this account, we decide to take out that information, it quickly loses trust in the public and loses their user base. Yeah.
Yeah, and infodemic is a huge problem that will require coordinated efforts from many different sectors of the population. And instead of, for instance, perceiving platforms as hostile or the government as infringing on one's freedoms, or government as attacking the platforms, or platforms undermining the government and so forth, I do think there needs to be a coordinated effort from all the different segments, community leaders, medical community, universities and researchers, social media platforms, governmental organizations, non-governmental organizations, actually working together to counter and address this infodemic, because it's not a problem that's only of the platform or of an individual. You know, we as individuals shouldn't really be expected to suddenly increase our digital literacy skills and be fact-checking everything that we're consuming. We don't have the time. Many people don't have the skills, and that's not our job as social media users for most Americans or most citizens around the world. So it needs to be an effort that's coordinated and that puts all the different resources and great minds together, because it is a huge problem, and that will only become even more relevant and more pressing moving forward. This is not the first pandemic, right? More will come.
Well, you're absolutely right. It's not comfortable
note.
to hear, but yeah, we don't want to hear that, but you're
exactly
right. Pandemics of many different kinds too. Yeah.
Yeah.
Well, listen, this has been really great. Thank you so much for coming on today and sharing your work.
Absolute pleasure.
Jingwen Zhang is an assistant professor of communication at UC Davis, whose work focuses on health promotion, social influence, and online interventions. And Magdalena Wojciechak is a professor of communication at UC Davis. Her research focuses on how people select political information in the current media environment and how that affects attitudes and behaviors. If you'd like to hear more about how social media and news consumption may or may not affect people's views and actions, plus more, I'll be speaking with Magdalena Wojciechak on the next episode of our new podcast called The Backdrop, a UC Davis podcast exploring the world of ideas. That episode will be coming out in a couple of weeks, and you can find more on the podcast, including previous episodes and links to subscribe to it by clicking on the link in the description. On the next UC Davis Live, we'll look into the coronavirus mutations and new variants and how they might affect our efforts to get the pandemic under control. Until next time, I'm Satirius Johnson, and this is UC Davis Live, COVID-19.
Thank you again.
Thank you.
Thank you.
I do need to go, but it was great. So I really appreciate all the good questions. And Jingwen, you rock. I'm your fan.